Hey folks, so as promised, I am Miss Ceci with Dr. Maria Herrand, and I came to visit her. But as I told you I would, since I'm here having a conversation with her, figured we would ask some really important questions and get her answers for you. So stay tuned, we're going to be talking to her in just a second. So the majority of my girls come for lipo BBL or lipo tummy tuck BBL, with a few variations, right? But for the most part, when you guys are getting quoted for these procedures, you typically ask the same question. How much time do I need to be there after surgery before I can go home without a problem, without my incisions opening, and so forth? How long do I have to stay in the country after these procedures? So let's talk to the doc and find out what she has to say.
So for tummy tuck and lipo and BBL, you should be at the country for a minimum of 3 weeks. That way you can do all of your pre-op, your post-op, your massages, and go back to your country with being fully restored and doing all your regular activities.
So if you're coming to the country for a lipo BBL without a tummy tuck, without a muscle repair, how long do I need to stay in the country?
For lipo and BBL, I recommend to be in the country 2 weeks and a half.
Okay, so that 2 weeks and a half, does that include the 2 days they need to be here before surgery?
Usually no.
No, okay, so we're talking about post-op time frames.
Just post-op frames. Yeah.
Okay, so I know this is a question that comes up a lot, and sometimes I don't give you the answer that you want. But I've always got to give you the truth, and I've always got to give you the information that's going to keep you the safest and make sure that you get your snatch that you want, right? So I keep getting asked, can I do lipo, tummy tuck, BBL, and my boobs at the same time? Let's ask.
The short answer is yes, but when you look up about it, it's really no, because when you do surgery of this type, it's a kind of trauma to your body that is too much to endure. To do lipo, abdominoplasty, which is the tummy tuck, and your breast surgery, we're looking about 4 hours in the OR. So it's not recommended by the health department or by our plastic surgeon society, so it's not recommended.
So I'm getting ready to wrap up my time with Dr. Maria Herrand. And I'm going to put her on the spot because what I love is for you guys to know these surgeons as much as I do. So, my question for you is, what do you love the most about being a plastic surgeon?
What do I love the most? What actually I love the most is the possibility that we have to talk to the patient and try to see what is that they need. Sometimes patient comes to us and they want something because they think that's what they would need for them to live a better life or to be the fullest. And to be able to actually help them in that process, to get to be that transformation, to be that new self, is very rewarding actually.
Alright, I've been here for hours, I'm leaving. But not without making sure that you always understand and that you always know that even if it's the unpopular decision, us at Sirena and our participating surgeons are always pledging to do what is best for you. Safety first, aesthetic results second. So always keep in mind that whatever you want to do, whatever is so important to you, whatever is worth this investment for you, understand that we understand that it's a big deal for you. It is an honor and a privilege to support you, to guide you, and to be beside you throughout this process, cheering you on along the way. And know that at the end of the day, if for whatever reason one of us deny you some type of service, some procedure, even if it's something that you really, really want, know that we're doing it for your best interest and not because we want to take your money. Okay? See you later.